Hi, caregivers. I am Donna Jackson, the adult caregivers coach, and welcome to the Curated Caregiver, the podcast where we bring you caregivers everything and anything related to your caregiving journey. And today we have AARP with us. We have Xavier Vaughn, who is the program manager of Medicare education from AARP's corporate offices. And he's going to present on us for us everything and a high overview and maybe some really great nuggets about everything Medicare related. Welcome, Xavier.
Hello, thank you for having me. I'm so excited about being here today. Once again, my name is Xavier Vaughn. I'm the program manager of Medicare education within the caregiving and health team at AARP. Medicare is such a great equalizer, right? This is something that we're all either going to go through ourselves, help a loved one in the caregiver role. And so this is something that we all need to know. And it doesn't matter where you are in your life, this is something that is going to impact you. So our agenda for today, we're just going to go over some Medicare basics, the choices that you have within the Medicare program, Medicaid, and other assistance program, and resources and tools that are there to help guide you and help navigate this complex world that is Medicare. So some common questions we typically get is, what is Medicare? What's covered? What's the difference between Medicare and Medicaid? When should I enroll into Medicare? What happens if I don't enroll? And how will Medicare work with my existing health care? So the basics. Medicare is a federal health insurance program for those who are age 65 and up. If you are receiving SSDI and are on disability, that 25th month, you are automatically enrolled. If you are age 65 and up, but you're still working, then you are not automatically enrolled into Medicare. But if you are 65 and you are already collecting your Social Security payments, then you will be automatically enrolled into Medicare. If you have end-stage renal disease and receiving dialysis, you also qualify for Medicare, as well as if you have ALS, you also qualify for Medicare. So keep in mind that age 65 and up and you're receiving Social Security, if you're receiving your Social Security disability payment for 24 months, those are both automatic enrollments. If you do not fall underneath those two categories, then you have to actively enroll with Medicare on the Social Security Administration website or going into a local office. So we know that from this quiz that it just all depends on your situation. So your responsibility is going to be very similar to what it is for your insurance that you get through your the marketplace or through an employer. You're going to have your monthly premium, deductible, co-insurance, and co-payments. So all that should feel very familiar to you. So what doesn't Medicare cover? And this is some stuff that I think a lot of people are really surprised to hear. Medicare does not cover long-term care. So that is going to be your nursing home care. And we'll go in a second, a little later, we'll talk about skilled nursing facilities, and do not get skilled nursing facilities and nursing homes confused. There are two very different things. Hearing, dental, and vision is not covered. And foreign travel. The only time some foreign travel may be covered if you're going to Alaska, because there's no way to get to the lower 48 to Alaska without going through Canada. So, if something happens in Canada, then it will be covered. And hearing, dental, and vision could be covered in some Medicare Advantage plans. And we'll go over and talk more about Medicare Advantage plans later on in the presentation. So Medicare skilled nursing care, this is going to be your rehab facilities. So think about if you are someone who maybe were in a bad car accident or maybe had a stroke and needs to learn how to walk again and get some of that rehab, then you would go into a skilled nursing facility. But even though it has that word nursing in it, it is not a nursing home. This is something that is meant to be for a limited time period. And Medicare will actually cover your first 100 days. So that is something, and then you have to pay a percentage depending on where you fall within those 100 days. So 100% for days 1 through 20, you pay co-pays for 21 through 100. And after 100 days, you would have to pay 100% of that cost. So your choices. There are two different avenues you can do. You can go with their original Medicare, something you may hear also referred to as traditional Medicare. And this is going to be your Parts A and Part B. And you can add a Part D and even a supplement or a Medigap to that. Or you can go the Medicare Advantage route. In this day and age, we know we love a good bundle deal. We bundle our phone, internet, cable all into one comprehensive plan. Now all the streaming services are being bundled into one plan. This is the exact thing that your Medicare Advantage plan does. It bundles your Part A, B, and most of the time your Part D into one comprehensive plan. So, Part B or Part A, which is the first part of original Medicare, this is also going to be your hospital insurance. So this is going to be your inpatient care, hospice and home health, and some skilled nursing facility care, as we talked about earlier. Typically, there is no premium for Part A. When we pay into Medicare, this is the part that we're paying into. And it takes about 10 years in order to get a premium-free Part A. For example, I'm 30. I have qualified for premium-free Part A for a few years now at this point. With that being said, if you do not qualify for a premium Part A, maybe you're a stay-at-home spouse, or maybe you are a younger person who is on Medicare due to a disability, you can draw off from a spouse or a parent in order to qualify for a premium-free Part A. And the deductible for 2025 will be $1,676 for days 1 through 60 of inpatient care. And the deductible can be applied again for additional hospitalizations after 60 days. So if you're in the hospital for something in January and you go back for something in June, you would have to pay 2 different deductibles. It's not going to be one deductible for the entire calendar year. It's yes. So coinsurance for Part A will be $0 for days 1 through 60, 419 days for 61 through 90, and 838 lifetime reserve days. So once you go above that number, you only have 60 days that you can use. And that's not 60 days per year. That is 60 days for a lifetime above that 90 days. Anything above that, once you use up all your lifetime reserve days, you have to pay 100% of that cost.
Well, wait. Whoa. Okay. So talk about this some more. So this is co-insurance. I've never heard this before. This is co-insurance. And how do you use up these reserve days?
So if you are above the 90 days but you're still within inpatient or in the hospital, then they will start using your lifetime reserve days to keep you at that lower cost of 838. But you only have 60 of those days for your duration on Medicare. And anything above that you have to pay 100% of the cost.
Ooh, wow. Okay.
Yes. So, but don't worry, we'll talk about different avenues and things you can do to help mitigate some of this cost a little later on.
Oh, that's so good to hear. That's good to hear.
Yes. So next we have Part B, and this is going to be your medical insurance. And how I like to remember, Part A is for hospital and Part B is for medical. If you put hospital and medical in alphabetical order, they go with their part. So A for hospital, B for medical. And this is what you're going to probably use more often than not. It's going to be your Part B coverage. So this is going to be your doctor visit to your primary or to a specialist, outpatient hospital services, your durable medical equipment. This is going to be your wheelchairs, your walkers. If you need a hospital bed for your house, that would all qualify under your durable medical equipment. And Medicare approved preventative services. Medicare has a long list of Medicare preventative services that is covered at little or no cost. This includes cancer screening, smoking cessation, diabetes classes to help you manage those, STI screenings. The list goes on. So your premium for next year will be $185 per month for those for Part B, and the premium does go up for those who have higher income. So if you're an individual make over $106,000, or a couple who makes over $212,000, you will have to pay a higher premium than that $185. With that being said, it is a sliding scale. So if you make 106, you're not going to pay as an individual. You're not going to pay the same amount as someone who makes $200,000. There is a sliding scale, and And if you have maybe if a parent passes away and you inherit some of your inheritance, and that's going to throw off your income for that year, don't worry, that there is just a 2-year look back, and it will always be readjusted. So you might have to pay for 1 year, but the next year you'll go back to the lower premium. You can also always appeal that decision as well. And with Part B, you are responsible for 20% of the cost. So if you were to go to your doctor's office, you would have to pay 20% of the Medicare approved cost. And there is an annual deductible of $257 per year with this. Prescription drug coverage, which is a fairly new coverage for Medicare. Medicare has been around since I think 1965, and Medicare Part D did not come into effect until 2006. And so this, right, a long gap. So this helps cover your prescription costs. And unlike with Part A and Part B, which is administered through the federal government still has oversight of Part D and Medicare Advantage plans, but these are administered through private insurance companies. So this is going to be your Humana, United Healthcare, Aetna, Blue Cross Blue Shield. These are going to be WellCare. This is going to be those type of companies who are going to be administered through this. So every year you'll get an annual notice of change if you're on a Part D or a Medicare Advantage plan, and this will come out in about September of every year, and this will let you know if there's any price changes within your within the plan. Also, if the pharmacy you're going to is no longer a preferred pharmacy and no longer will be covered by that plan, it'll let you know. And if the medication that you're taking is no longer on formulary or no longer a medication that's covered by the plan, that will all come out. But it's really important to look at this every year, as a lot of things can change within your Part D plan. And we'll talk about that more when we get into open enrollment. So there are a lot of really great changes that are happening between last year of 2024 and this year of 2025. So some Part D improvement. Insulin is now available for $35 per month, but it's also really important to note that not every Part D plan or Medicare Advantage plan is going to cover every single insurance or insulin. So it's really important to make sure you know what insulin you're taking and making sure that your plan is covering that insulin. If not, you may need to go to a different plan or talk to your provider to see if you can't switch to a different insulin. You'll have a larger range of adult vaccines that will be available to you without any cost sharing, so it'll be zero cost to you. And one of the really great things is this year, there will be a yearly cap of $2,000 for your Part D spending. So, for example, in 2024, the out-of-pocket was $8,000, and we're going all the way down to $2,000 per year. And not only is it $2,000 for the year, you can now spread out that $2,000 throughout the entire calendar year. So if you're on a high-cost medication where you typically might have reached $2,000 within maybe the first 3 months of the year, that now can be spread out. That cost can now be spread out throughout the entire calendar year. And it gives you much more freedom financially.
Oh, wow, that's awesome.
Yes.
That's fantastic.
AARP is tirelessly fighting for you and for your loved ones to make sure that Medicare is the best that it can possibly be. And we will continue to fight in the years to come. Also, there is an assistance program called Low Income Subsidy, or LIS, or Extra Help, which is a program administered through the Social Security Administration, and it helps those who are lower income and are on Part D or a Medicare Advantage plan. They're just getting that drug coverage. And they have made it to where people who are 150% of the federal poverty level and lower will be qualified for this. So they expanded. Some people used to qualify for partial extra help. And so partial extra help is no longer there. It is now everyone who is qualified can get the full coverage.
That is nice. Oh my goodness.
Yes. And so the next option we have original Medicare, which this is just going through what we already talked about. Your original Medicare is going to have your A and Bs. And the really great thing is, with insurance companies, as those of us who are on maybe the marketplace or have insurance through our jobs, we have to deal with in and out network, right? But with original Medicare, there is no network. It's just that you can go to anyone all over the country who accepts Medicare.
Oh, that's great. So wait, I thought earlier did I hear you talk? You never talked about in or out of network, right?
No, because
Oh, okay.
with the original Medicare, you can go anywhere that accepts Medicare, and most providers are going to accept Medicare. The only
Oh,
And so the only thing is that with a Part D plan, you just want to make sure that the pharmacy that you go to is a preferred pharmacy.
got it. Got it. And it has to be one of those. When you were talking about, the large insurance providers,
Mm-hmm.
it has to be one of those. But that's all there is, right? We don't really have any other options, right? Is that true?
Right. So, and that's for Part D only is what the
Okay.
insurance company. And then we'll talk about the same thing does apply for Medicare Advantage plan, which we'll talk about next. But for your A and B, there is no insurance company that administers that. That is all through the federal government.
Okay, right. Okay, got it. Oh,
And so one of the things that we can do to help mitigate some of those costs is a person can sign up for a Medigap or a supplement plan. And unlike with original Medicare and even the Medicare Advantage plans and the Part D plan, which are kind of oversaw and regulated at the federal level, the Medigaps and supplemental are going to be regulated at the state level, which means there are going to be different rules for different states. And so that can be very beneficial depending on what state you're in. And so Medigaps or supplement, they do exactly what it suggests. It helps fills in the gaps or supplements original Medicare. This does not have, but you cannot have a Medicare Advantage plan and a supplement plan. You have to choose one or another. And the plans are Plan A through N. And it's really important. I said plan, right? I didn't say part. With original Medicare, right, we're dealing with Part A and Part B. But with Medigap, you're going to have a plan. You're going to have a Plan A, a Plan B. So do not get plan and part confused with one another.
Okay. Wow.
And so
how you should. Okay, I'm going to let you keep going because I'm thinking about questions already. I'll wait till you finish this segment.
Okay, so you can buy a policy, and it's really important to sign up when you're first become eligible with Medicare, because unlike with other parts of Medicare, Medigaps or supplement plans can go through underwriting. So they're going to look at your medical history to determine if you qualify for a plan if you do not sign up when you're first eligible for Medicare and have that guaranteed issue. Mm-hmm. This does not cover any prescription drug costs or hearing, dental, and vision. But what it does help you with is that 20% that we were talking about, that for Part B, it will help you with that. I've heard stories about people who had massive heart attacks. They had the top tier plan, and they went in and they came out with no medical debt because their supplement plan covered everything.
Nice.
And so this is going to cost you, they could be maybe between $100 to $200 per month to have one of these type of plans. Mm-hmm. With that being said, how I like to talk about it is with this, you're going to pay more upfront, right? You're going to have that monthly premium upfront. But if you have a medical emergency, you're going to pay hardly anything.
Got it.
When we talk about a Medicare Advantage plan, which we're going to talk about next, you're going to have a pretty low monthly premium, if you even have a monthly premium, but you could have an $8,000 to $10,000 out-of-pocket max associated with that plan, right? So it really depends on what you can afford, a person can afford, and what their health needs are. If you know you're a high utilizer of a plan, and you know you can afford it, then this may be something that you should look into, especially since you're going to have to deal with the in and out network with all of this. When we go into a Medicare Advantage plan, we're going to start dealing with in and out networks.
Got it. Let me ask you a question just for clarification here. The plans, the Medigap plans that are from A to N, did you say that they could be anywhere from $100 to $200 per plan, so per letter?
So it would be that would be your monthly premium cost, and so you would just sign up for one plan, So say I'm enrolling to Medicare. I decide that the top tier plan at this point, often referred to the Cadillac plan, is Plan G. So if you were to sign up for that plan, then it would be maybe between $100 to $200. And what's is a really important thing to note too, as well. A Plan G is a Plan G is a Plan G. There could be up to 50 plans or 50 companies that are going to sell you a Plan G, but they're all going to sell you the same exact thing.
Okay.
But the cost is going to vary widely between them. So what I always encourage people to look at is to look at the market share, see how many people are enrolled into that plan. Because if a lot of people are enrolled into the plan, then they're probably going to be a fairly good plan, right? And also look at the complaint index to see how many people are complaining about said plan. So if you look at those two things, look at the cost, that's going to give you a good measure to which plans you should enroll into.
That's really great advice there. So wait, one more. So you're saying that with the plans A through N, you can only sign up to one of those plans?
Yes.
Okay. Got it.
Yes. And so each plan is going to offer something a little different. And it's just, and so depending on how much is covered or how much they pick up, depends on how much your monthly premium is going to be.
Okay. Got it.
Okay. So Medicare Advantage plan, this is what you're going to see all those commercials for, right? You're going to see Jimmy Walker, JJ from Good Times. You might see him on one of those commercials. Yeah. So this is going to be your Part C or a Medicare Advantage plan. Those are the same exact things. A lot of people get confused. They're like, well, what about Part C? I have a Medicare Advantage plan, but what about Part C? Well, they're one and the same.
Okay.
And as you could remember earlier, this is what we bundle all together to be one comprehensive plan. And so this is going to be an alternative to original Medicare. And right now, it's about a 50-50 split. About 50% of people are on Medicare Advantage plan, and 50% go the original Medicare route. And this is something that you decide when you're first enrolling to Medicare. You can, at a later date and time, go back and forth between the two if you choose to do so. But first, you have to be enrolling in the original Medicare. You have to have your A and B in place first before you can even think about enrolling into a Medicare Advantage plan. And just like with Part D, these are offered by private insurance companies. And it's going to bundle your Part A, Part B, and Part D most of the time into one comprehensive plan. If for some reason you decide to pick a plan that doesn't have a Part D coverage, then you can pick up a separate Part D plan. And this may limit your ability to purchase a Medigap in the future. As we talked about, Medicaps is something that you really want to enroll in when you're first eligible, for you don't have to go through underwriting or they will look at your medical history. So what does it cover? What does it include? As we said, it includes both Part A and Part B. Most of the time, it's going to have your Part D. And this is what's really attractive to people. They're going to have some extra benefits depending on the plan that you select. So this is where we can get into some hearing, dental, and vision. But it's also really important to know, look at that fine detail to make sure to see if it's comprehensive or not. A lot of times it may not be comprehensive, but for an additional fee, you can upgrade your plan to make it a comprehensive plan. It may also have some home delivered meals, transportation to doctor visits, home modifications. So if you need like maybe a ramp to get in your house, it may help with some of that. And so this is what makes it really attractive to people, and also the low monthly premium as well. But like I said, you have to keep in mind, if you're a high utilizer of a plan, you want to pay up front with your with a Medigap plan, or you want to pay on the backside here with a Medicare Advantage plan. It really all depends on what your healthcare needs are and what you can afford.
And can you switch back and forth between the Medigap plans without going to another round of underwriting?
So if you're on a Medigap plan and you choose to go to a different plan or a different company, that really all depends on what state you're in.
Oh, okay.
So for example, right now, I'm in Missouri. That's where I got my start in the Medicare world, right? During your anniversary period, when you first signed up for a Medigap plan, if I'm in a plan N, for example, and I feel like my monthly premium is just getting too high, I can shop around during that time period and go to a different company within the same letter plan. So And so that allows you to have a little more flexibility. It also helps you if you have to go through underwriting, because you may sign up and you might get admitted into a plan that first year, have high costs with your with that plan because you went through underwriting. Next year, you go to a different plan and your underwriting practically disappears because they won't take that into consideration anymore. So that's why it's really important to know what the rules are for your state.
Mm-hmm.
And the
Wow.
great thing is later on when we get to the resources, I'm going to give you a really great state-specific resource that will be there to help you.
Oh, nice. Okay.
So with Medicare Advantage plans, you have to live in the plan service area. So they're very county specific even.
Mm.
And so it's really important. So if you move, that you update and you can call, and it will trigger you a special enrollment to switch your plan. You may have to use the providers in the plan network because these are going to be your HMOs, your PPOs, stuff that you're very familiar with. It's going to be just like your employer-sponsored healthcare plan, right?
Mm-hmm.
May have to pay additional premium and may have to follow the company rules like getting referrals to go to specialists and things like that. Part D, cost depends on additional monthly premium, deductible, co-payment plan rules, and any extra benefits. Everything that we kind of already went through. So how can you compare plans? Should you sort through the mail that you receive as a friend or relative, or identify the plan with the lowest monthly premium, or use the plan finder? You should use the plan finder. Insurance is very individualized. It's something that's very specific for you and your own needs. So you can maybe sort through the mail and get a baseline, like, oh, you like some of the stuff you see in that plan, to do more research to see if that plan is best available to you. You can ask a friend or family what they prefer, and they can say, this was my experience, but that doesn't mean that won't be your experience. And just because the plan has the lowest monthly premium doesn't mean that it's going to be your lowest monthly cost when you take in consideration the medications you take. But the really great thing is if you use that plan finder on Medicare's website, medicare.gov, you can create an account and see all this information that is specific to you and your needs. And we'll talk a little bit more about Plan Finder a little later on. So when do I enroll into Medicare? If you're receiving Social Security and 65, or you're on that, about to be on that 25th month of SSDI or disability payments, then you know that you get automatically enrolled. And you have a 7-month period on when you can enroll. So you have 3 months before your birth month, and 3 months after. And for if you're on receiving disability, think of that 25th month as your birth month. So you have the 3 months prior, your 25th month, and then 3 months after. The one caveat to that is if you're born on the 1st. So, for example, my Uncle Charlie, he was born on June 1st. His birth month is no longer June, it's actually May. So it moves up the process a month earlier. So that's some things to keep in mind. And if you are still working and you're receiving coverage through either yourself still working or a spouse, then you can delay your enrollment most of the time, and you would qualify for a special enrollment period later. But with that being said, it's really important to sign up when you're eligible to do that, whether that is when you're first eligible or during that special enrollment period because you're still working. Okay, if not, you'll have to pay a late penalty cost. And we'll talk about the penalties a little later on, but the penalty most of the time will stick with you for a lifetime.
What? What does that mean?
We'll talk about it a little later on. Don't worry, but the penalties will stick with you for as long as you are alive.
Oh my gosh!
So that's why we really drill in to sign up when you're first eligible, and also even though Part D is optional, you'll see a little later on. Even though it's optional, you should probably sign up when you're first eligible.
Oh wow!
So open enrollment. Open enrollment is the same exact time every single year. It's going to be October 15th through December 7th. And during this time, this is when you can shop around. It doesn't matter if you have a Medicare Advantage plan or you just have a Part D plan. This is when you can shop around. If you have a Part D plan, you can stay with your plan if you determine that is still the best plan for you. You can go to a different Part D plan, or you can make the switch to a Medicare Advantage plan. And you can do the exact opposite. If you're on a Medicare Advantage plan, stick with that plan, go to a different Medicare Advantage plan, or go to a Part D plan. Keep in mind, this is not the time period to shop around for a supplement or a Medigap plan. that is when you're first eligible. You could shop around, but that's not guaranteed that you're going to get enrolled into that plan. So just keep that in mind. Medicare Advantage open enrollment period is January 1st through March 31st. This is the time, if you are on a Medicare Advantage plan, decide, hey, this isn't really working for me. Let me see what my other options are. You can go to a different Medicare Advantage plan, or you can go back to our original Medicare and pick up a Part D plan during this time, which is January 1st through March 31st. You also have the general enrollment period, which is the same time period of January 1st through March 31st. This is for the people who didn't have all their ducks in a row, and they need to sign up for a Medicare Advantage plan because they're outside of their open enrollment or their special enrollment period. And so this is when you can sign up for Part A and Part B. But this only happens once a year, January 1st through March 31st, and your coverage would begin the first of the following month. It's really important to note that during your open enrollment period that you'll receive that annual notice of change that we talked about earlier to let you know all the changes that are happening within your plan. Every year you'll get this really thick book in the mail called the Medicare and You book. And that it will tell you all the information that you need to know about the upcoming year for Medicare and different things. And it's really important to compare and shop. And if you need assistance, you can consult your SHIP or your State Health Insurance Assistance Program. And this is where if you need they're going to, with SHIP, so State Health Insurance Assistance Program, this is individualized for each state. So every state and U.S. territory has a SHIP, and they provide free and unbiased Medicare counseling. They're not affiliated with any insurance companies, so they can show you all your options. They will screen you to see if you qualify for any assistance programs. If you are someone who needs to sign up for Medicare, they can help you with that as well. They can help you with almost if you need to file uphill because something isn't happening right, they can do that for you. The only thing they cannot actively do is sign you up for a Medigap or supplement plan. But what they can do is show you all the options and talk about some of the things that I mentioned earlier, and they can lead you down the right path and say, this is who you need to call and help you get enrolled. SHIPs, like I said, they're free, a really great resource that is really, they've been around for over 30 years, and they're still the best kept secret in the Medicare game.
Wow. Nice.
And the great thing is, if you need the number, flip over that thick old Medicare and You book, and it's on the back.
Nice.
So special enrollment. This is going to be if you are transitioning from working to being retired, if you move to a different state, going into a nursing home will also trigger a special enrollment period. So these are just different life events that will trigger you to have other opportunities to see what your new options are available to you. Medicare fraud, please protect your card. With that being said, if you are trying to help, if you call someone for help with Medicare, they are going to need to know your Medicare number. I don't know how many times when I was counseling people one-on-one, they said, well, they told me not to give my information out, which is true. But just remember, at some point, they do need to know some of that information. Remember, Medicare will not contact you and ask for your personal information, and they will not call you to sell you anything. And check for billing fraud. And that's one of the really great things. You can go on the Medicare website, create you that account. You can see some of your Medicare summary notes and some of your billing on there. So when do employees sign up? This is something that is really important to know. And they have and these are things that we kind of already talked about. And so it's really important to note that if you are a small employer, so 20 or less, then your employees have to sign up for Medicare. And Medicare will become their primary. If you work for a place where the where you have 20 or more, then your employees have options. They can delay their enrollment altogether. They can do a hybrid approach where they sign up for Part A. To remember, Part A is free for most people. And then delay their Part D enrollment until retirement. Or they can sign up for both A and B at that time. So it depends on the size of your employees. 20 or less, sign up for Medicare. You have to. 20 or more, you have the 3 different options. The one caveat to the small employer is if they are in a group health plan. If they're in a group health plan where someone qualifies for a large employer, then everyone qualifies for it. And you then qualify for the large employer route. So those are just some things to mind. Small employees, 20 or less, sign up. More than 20, you have options. Now, these penalties that we were talking about earlier, and remember, these penalties for Part B and Part D, they stick with you for a lifetime. Part A, if you do not sign up for when you're first eligible, you have to pay that penalty for twice the number of years you went uncovered. So if you did not sign up for Part A for 2 years, then you have to pay the penalty for 4 years.
Mm-hmm.
Now for Part B, this for every 12 months you go uncovered, and it's really important to note that it's 12 months. So some people might hear 11 months and just round up to a year. No, it's every 12 months you go uncovered. You have to pay 10% more. So next year, $185 is the Part B premium, or for this year for 2025 is $185. So you would pay $1,850 more on top of that $185
per month.
Per month. So if you go years with going uncovered, that's $1,850 more per year that you would have to pay on top of the $185. And this will stick with you for as long as you have Part B coverage. Now, this is what's really tricky is Part D. Part D is optional, technically. But if you do not sign up when you're first eligible, then for every month you go uncovered, you will have to pay 1% of the natural base beneficiary premium. And for this current year of 2025 is $36.78. So you have to, for every month you go uncovered, you would have to pay 1%. An example that I have is, I think this was probably in 2018, I was helping a lady, and she never signed up for Part D. From 2006 to 2018, never signed up for a Part D plan. So that's 144 months she went uncovered. So she would have to take this 3678 times it by 144%. And in Missouri that year, the lowest Part D plan was $15. It was a great plan. We signed a lot of people up for it. But she would have to pay $15 for that plan. On top, pay that 144% penalty. So the penalty ended up going to cost her more than the actual plan would cost her.
Right.
So it's really important to sign up when you're first eligible, for you do not have these penalties.
So this is such great information. I mean, I thought I heard you say that if you're an employer with more than 20 employees, that they could delay signing up to Part D.
Yes. And so they would not qualify for this because they have coverage still.
Through the group.
Right. Through their employer. Yes.
Oh, okay.
And so they would qualify for a special enrollment for when they do decide to retire and leave that coverage.
And they wouldn't have penalties assigned to them.
Correct.
Okay. Got it. Mm-hmm.
And so the one caveat to this, I should note that if you are someone who is under the age of 65 and you incur a penalty, once you become 65, it's kind of like a Medicare do-over. And so you kind of start off with a clean slate.
Oh, that's good.
And
so what was for life? What was for life then?
So technically Part B and Part D is for life. So if you were to get it, if you're 65 and incur those penalties, then they will stick with you.
Got it. I got you.
The other caveat is if you qualify for an assistance program. So that's what we're going to talk about next. Medicaid and other assistance programs. So you qualify for Medicaid. And earlier we talked about low-income subsidies. And there's another program called Medicare Savings Program, which is kind of in between Medicaid and the Extra Health Program. If you qualify for any of these programs, then your penalty will be waived for the rest of the life. So even if you no longer qualify for any of the assistance programs, once it's waived, it's waived.
Okay.
And so we talked about Extra Help in Part D and how it helps you with Part D. If you have qualified for a Medicare Savings Program, it also you're automatically enrolled into that program, but it also helps with some of that Part D costs. Part B is in boy costs. Then Medicaid, this is something that's varies from state to state, but it does help you with some long-term care, and you do have to have income and asset limits that you have to adhere to. Other programs, there might be some more state programs that are available to you in your state, disease program or government programs. Some resources, Medicare.gov. This is also their 1-800 number. It's 1-800-Medicare if you forget 633-4227 is just 1-800-Medicare, or go on the website. I would go on the website for you wouldn't be tied up in a long call period. But this is another resource. Medicare Rights Center is a really great nonprofit that delivers really great Medicare information along with the SHIPs, which we talked about earlier, with that free unbiased Medicare counseling. You feel free to go to either website and you can get more information. You can call this 1-877 number for the SHIPs, and based off from your area code, it will direct you to the state that you're calling from as well, if you don't want to go and find your state-specific number. But also remember, it is on the back of that Medicare and You book. AARP, I have to talk about some of our resources. If you go to aarp.org/Medicare, this is our Medicare landing page. You'll get all the latest articles that are being written on Medicare, and some of our resources that we'll talk about a little later on will be included, like the Medicare Enrollment Guide, which is a great tool that we have, and we are about to launch AARP Navigator, Medicare Initial Enrollment. And this is a course that is designed for members only. So if you're an AARP member, you'll have access to this course. You answer a few questions, and you get a self-designed course on where you are at in your current Medicare journey. So it's going to be a really great program, and it will complement this Medicare Enrollment Guide. Nice. We also have the Medicare question and answers tool. So if you go on our website, can't figure out the question, you can go in and search for the question. And if that question hasn't already been answered, someone will answer that question and you will receive that question back to you. So in conclusion, Medicare is a lot to handle. It can be quite confusing, but AARP and other great nonprofit and other great resources are there to help you navigate this complex world that is Medicare, whether that's just knowing what avenue to go, or if you are someone who feel like you may qualify for an assistance program. We are here to help to make this Medicare world as easy as it possibly can.
Wonderful. Xavier, this is amazing. There's so much information that you just, effortlessly just laid out for us. You guys, anybody who's listening, just listening only to this podcast, I encourage you to go back to one of the platforms that this is on, where you can actually see the slides. That will be super helpful. Although Xavier really laid out everything in such a fashion that you'll be able to, follow the discussion and, go to the resources that he pointed out and navigate those sites as well. Xavier, thank you so much. This is a lot. You guys, I'm sure during this segment, you had to pause the recording to jot things down. This is really critical. I have learned more. You think you know some things because you've been around it or you've heard discussions and everybody's talking about these topics that as we're aging, they're becoming more prevalent, more relevant in our lives. But my goodness, there's so much that we still do not know. And I think one of the main kind of lessons or messages that Xavier has given us is prepare, plan, do not wait until the last minute. There's so much out there that over these last almost 60 years with the Medicare programs that have improved, and they are constantly evolving and improving because the need is growing, and that there are lobbyists, there are organizations like AARP that are fighting for the rights of our aging population. And so there's no reason, there's no excuse anymore to, just throw up your hands and say, oh, it's just too confusing. I just don't want to deal with it and bury your head in the sand. Unfortunately, even that will come with some penalties. And so, my goodness, listen to this 2 or 3 times, share it with somebody who might be entering this season of their lives or caring for a loved one who may not have taken care of this, 5, 10, 15 years ago, but really should. There's a lot of great stuff here. So with that, thank you, Xavier. This was wonderful. And just, I just thank AARP for being just leading the pack, leading the way in this space for us. So I know we'll be hearing more from AARP in the coming months. But thanks again.
Thank you.